Medical imaging, in terms of relatively modern medicine, has always been important. In fact, you may recall that X-rays were discovered in 1895 by Röntgen, and within 4 months that technique had actually been applied in medicine, particularly in the study of fractures, in bone fractures. And the field has really grown continuously since then. But it really took off in the 1960s with the invention of techniques that allow us to look deep inside the human body in 3 dimensions.
So when we talk about a molecule or a compound or a radioisotope or a medical isotope, we're just talking about small molecules that go into the body and accumulate in sites of disease. And they all operate on what's called a tracer principle. So that's probably the best word for it, is a tracer. It doesn't actually do anything, it doesn't affect you in any way, but it's a trace molecule that goes into your body and builds up a picture of what's happening in your body without giving you any kind of chemical effect. And to make a PET isotope, often almost always made on a cyclotron. So the most common one is fluorine-18, that's made on a cyclotron. And then after that's prepared, then we attach that to whatever molecule that we know will direct that isotope to what disease you're looking for. So usually it's cancer. And what we do is when we make it, we make FDG, we produce it, we dispense it into different vials that go to different PET imaging sites around Perth, as well as our own hospital. So everything has to happen incredibly fast and timed so that in between making it and sending it out the door, we are testing that it passes all the tests, that it is what we say it is, and that it's safe for injection. And patient who goes to a hospital will be referred to by a doctor. The doctor says we need this type of scan. We make that tracer. The doctor is going to take that tracer and inject it into a patient. And that patient will then go onto a PET scanner and they'll lie on a bed. And that bed will go through a ring detector. From the detectors, it's fed into a computer. It will develop a 3-dimensional image. And if we radiochemists weren't making FDG, for example, in Perth, there is no way that the number of patients that get a scan every day in this state would get done.
So if you're imagining a world without these technologies and techniques at the disposal of medical experts, you'd have to go back at least to the 1960s.